I hope you're having a lovely rest on the first. We are talking health and some tragic news out of the UAE. A 17-year-old student dying cardiac arrest in Sharjah. It's understandably shaken many families and raised questions around heart health in teenagers and young adults. And these cases are rare, but they're devastating, and they do remind us that heart conditions are not just an older person's issue. So what do parents, schools, young people themselves need to know about warning signs, about prevention and, of course, intervention too? Dr. Jairam is with us today, Consultant Interventional Cardiology Programme Director, NMC Healthcare in Abu Dhabi. Doctor, how are you today?
And thank you so much, Helen, for having me on air. It is my first time, and it is indeed an honour.
I will be kind. Don't worry. I am here to simply pick your brains. But if you get a bit too technical, Doctor, I might need to rein you back in again. I really appreciate your time and insights. I think it's really important, as I said, to highlight just how rare these cases are. But I think they do, unfortunately, shine the light on why and when this can happen. I don't know if we've got any numbers as such, but in your experience, how common are heart attacks or, sudden cardiac arrest in teenagers and adolescents? And, what are you seeing?
Right. So just to clarify what we said, first of all, we do see a mildly increasing trend in the presence of heart-related complaints in teenagers and adolescents. But the term heart attack and the term heart disease or sudden cardiac death are quite different. Mm-hmm. So heart attacks most commonly happen because of blockages in the blood vessels that supply your heart. But the cause for sudden cardiac death amongst teens, only a small percentage of it is actually a heart attack. There are other causes for it, namely problems with the electrical supply and activity in the heart, and or problems with the muscles of the heart. So if the heart muscle becomes weak, or if there's an abnormal electrical activity, these are more common causes for sudden cardiac death as compared to actually a heart attack.
So I just want to make sure I understand. So when I think about heart attacks, I do, and it's a very stereotypical kind of tired vision of, an older, overweight guy clutching his chest, something's happened, or, it's a lifetime of, perhaps smoking and overeating and unhealthy lifestyle. Whereas if I'm understanding correctly, when it comes to younger people, it's more like underlying conditions that suddenly come to the fore. Maybe it's a congenital problem, or as you say, the kind of weaker heart muscles. So can it be then very silent and unexpected?
Absolutely, Helen. That is very well pointed out. So having said that, eating fast food, eating, unhealthy eating habits, smoking, lack of physical activity, unfortunately, is not just something that affects the older generation. The younger generation, too, is in some way responsible and being careless about maintaining their health. Mm-hmm. And that can predispose to premature heart disease. But yes, the feeling of a heart attack with the person clutching his chest is ubiquitous across all ages. Now, in patients who are younger, especially teenagers, you could still have heart attacks happen because of congenital problems in the blood supply to your heart. Having said that, the more common reasons for this are where either because of infections or inflammations of some kind or certain connective tissue disorders, the heart muscles become weak or become excessively thick, both of which predispose someone to having sudden cardiac death. Also, disordered electrical activities can do the same.
And I think that lifestyle piece is actually really important, because when we think about maintaining a healthy weight at any age, and as you said, eating well, we're seeing, rise in vaping, we're seeing, energy drinks, we're seeing poor sleep. These do not contribute to good heart health, but there are people who will have had issues that will, would perhaps unfold into heart conditions or problems regardless. I wanted to ask a little bit about doctors in the UAE have been calling on schools recently to implement blood pressure screenings. A study found that instances of high blood pressure in teenagers and adolescents has almost doubled in the last 20 years. What's your take on early screening in order to perhaps establish or identify problems in teens?
I'll give you a little surprising fact, Helen. cholesterol deposition happens in our heart arteries from as young as 2 years of age, right? So that's preschool. So therein lies, and I think this is a wonderful, wonderful initiative by the Department of Health in Abu Dhabi and in general in the UAE. So you have all the departments of health collaborating in this. And early screening, I think, is really the key to early diagnosis of a problem. And therefore, it's, intervention in a timely manner. It's something akin to, if your car tires have a pressure of 26 instead of, let's say, 32 or 33, which is normal. It's better to catch it when it's at 26 and refill your air than wait for it to become 14 and have an accident, right?
You'll be very proud of me, Doctor. I did my little A screening, my lipoprotein A, recently, yes. And it was like, I'm just a big fan of information, to be honest. And I was like, if I get this screening done, then not there's anything I can necessarily do about something that is either there or not there, but at least it's information. And at least if I know when it comes to my cholesterol levels, my little a, then if there are adjustments that I can make, then that is just good information. For what it's worth, all very healthy on the heart front over here on Afternoons with Helen Farmer. Can I ask you a little bit about responding? Maybe something happens in school or on the sports field. What role do, CPR training, for example, play in preventing deaths and, making sure that someone gets to hospital or gets the help they need on time?
This is a very, very pertinent point. And if you ask me, the two main drivers of preventing sudden cardiac death is the presence of an external defibrillator, which I think should be mandatory in most schools. It's already there in most of the malls, and you'd see one every 5 or 10 kilometers. But also to have someone who's trained with basic resuscitation. And I think most schools nowadays have a nurse that's able to do it. Early CPR and defibrillation, I think, are key drivers to preventing sudden cardiac death amongst the youth.
And I think, actually, it's one of those things you hope you never have to use. And I know when I became a parent, even though I was heavily pregnant, I went along to a first aid training course and was like, okay, it's time to be a responsible adult. There's going to be a child in the home. I need to know what to do if there's a choking. And then I also think it's really important if you're having someone in your home to help you, as a nanny, that they have training too. Because if you're at work, you need that peace of mind that your child is going to be in safe hands. Dr. Jairam, can I ask you a personal question? And that is, with all of the work and research and clients and patients you see and conversations you have around heart health there at NMC, is there anything that you absolutely do not do or absolutely do incorporate into your daily routine, your exercise, your supplementation with good heart health in mind? I'm thinking about just maintaining good heart health that we could all borrow from your years of experience. What's on the naughty list and what's on the nice list?
Okay, so there are 5 things that I would recommend that everyone does, be it a teenager, be it a middle-aged individual, be it an elderly gentleman. The first, right, is I think what all you radio jockeys do very, very often for all of us, and is to bring a smile to our faces. So maintaining a level of happiness is the most important key to maintaining good health from a mental perspective. That's number 1. Number 2, hydrate well. This is a hot country and we need to be well hydrated. A number of events can be prevented simply by making sure that we've drunk our 3 liters of water a day. Number 2, eat healthy. Thing I tell most of my patients is, like we encourage our children in school to take meals from home so we know what's cooked and what's prepared. And on the weekend, we allow them to go out and have a pizza or a pasta. I think most days of the week, if we eat healthy, I think we are sorted in what we do. In terms of eating, maintain a good ratio of the healthy fats. So if you're non-vegetarian, you could have an egg a day. You could have chicken. You could have healthy fish like tuna or salmon. You could have a bunch of nuts a day. All kind of vegetarian food is generally, in general, good for you. Number 2, make sure you get at least half an hour of physical activity incorporated into your daily activities. And this would be from a perspective of actually exercising. So, walking from your chair, let's say, to a neighboring chair or a few feet away and coming back is better than sitting on it. but certainly does not count towards exercise. And this exercise needs to be done from a perspective where the heart rate goes up to about 60 to 70% of your maximum heart rate and is maintained there for about 20 to 30 minutes. Number 3, find time to do activities that make you happy, that help you relax your mind. It could be prayer, it could be hobbies, it could be meditation, it could be yoga. Number 4, get adequate rest. Mm-hmm. So 6 to 8 hours of uninterrupted sleep, I think, is the need of the hour. Number 5, try and limit social media to doing things that are educative, help you, grow from a mental perspective. Number 6, find time for some sports, and also like the Friends song that was just going on in the background. Make sure you're physically with friends all the time.
Yeah, be connected. I'm really glad you mentioned sleep there, because I think I literally, to Dr. Sarah, who was just in earlier, the chief of emergency, she'd worked in Canada for a number of years, and there's some really interesting studies relating to when there are daylight savings time, when people effectively lose an hour of sleep, and the spike we see in heart attacks and cardiac arrests on that one night, on that 24-hour period, because of the impact that sleep has on your heart, which I find absolutely fascinating. But, it helps regulate our blood pressure, it helps us manage stress, it controls hormones. And I'm going to hold up my wrist to show you on the camera. I'm very analog. I'm wearing a Casio today, not sponsored. How do you feel about tracking things like, your heart rate variability? Is that data that you find interesting yourself? Do you feel like that's something that would be interesting for teens or any person to take an interest in? Or can it tip into obsessive data anxiety?
Yes, so you hit the nail on the head. So wearables are excellent as long as the data is analyzed by the professionals. But if it's something that makes you jump every time you hear a little ping, I personally would not recommend it. And if I showed you my wrist, they were without any watch at all.
Dr. Jairam, thank you so much. And finally, just to come back to our young people, our adolescents and teens. And I think, unfortunately, and after many years sitting in this seat and speaking to many, many experts, it does often come back to those pillars. It is the sleep, the hydration, the nutrition, the healthy weight, the social connection, which I think you explained beautifully. But this starts early. As parents, we have a responsibility to instill some of these good habits in our kids and our teens. And I wondered, away from those who might have a congenital problem, away from those who have perhaps an underlying issue, what would your key message of reassurance be to families who want to protect young hearts without creating fear? So
I think certain things are absolute no-nos. Smoking, vaping, e-cigarettes of any kind. The only people that those benefit are the doctors. So please stay away from it. Mm-hmm. Number 2, make sure children are well hydrated. Number 3, be diligent and watch for symptoms. Often, these symptoms are mild and go unnoticed. You'd have a child that comes to you and says, hey, mom, once a week I feel a little dizzy, or I'm not able to keep up with my friends who are playing football on the field, or I feel like I'm panting a little too much, or I feel my heart is palpitating. And, as parents who are busy, who are probably both working, we tend to neglect these symptoms. Mm-hmm. I think symptoms in children should not be neglected. They're the most honest people on earth. They would never lie about anything. So any symptoms, maybe a quick visit to a doctor or a professional who tell you that things are indeed okay and there's nothing to worry about, I think is key to preventing any such problems. Also be aware if there are any problems of premature death in the family, make sure everyone in the family is screened.
Thank you.
Yes, make sure they're happy all the time.
I really appreciate your insights today. Really enjoyed catching up. I'd love to have you in the studio next time. But in the meantime, wishing you and everyone there at NMC Healthcare in Abu Dhabi a very healthy and happy 2026. Dr. Jairam Aithal, Consultant Intervention Cardiology Programme Director, offering us some fantastic advice regardless of our age and stage in life.
I was a better athlete when I went back to chase the Cuba swim in my 60s than I was in my 20s. Somehow for me, the deepest drive is